Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and we have a super exciting show for you today. We are going to be doing some cool sculpting. Come on over, my friend. This is Carly, and you've probably seen her in some of our videos anyway. Carly's our nurse practitioner. She is a superstar, and today we're going to do cool sculpting on her. Yes. So this will be her first time doing this. So
excited.
Sorry, the camera just fell, so it's live, people, so this is what happens. Anyway, so then I have, come on in, we have Jill, who is our nurse who's been with us for on and off for 10 years now, and Jill is also a superstar. I have a million superstars that are here, and so Jill's going to be the main person that's going to go through everything with you with the cool sculpting, and then Nicole's in our background, which Nicole, if you don't, I know you watch these videos, so everybody should know who Nicole is, or if you come visit, everybody knows Nicole. And she's been with me now almost 9 years. Holy schmoly. So she's my work husband, my work wife, because I think she knows me better than my husband that I live with at home, who we've been married almost 20 years now. So Nicole is definitely somebody who we need in the video and in our clinic. So let's talk about cool sculpting, okay? So when I asked Carly to do cool sculpting, Nicole started to evaluate her, and really she doesn't have much going on her abdomen. So what areas bother you?
My flanks or love handles.
Okay.
These bother me.
Okay, so what I'm going to do, I'm going to step back, and I'm going to let you do your job. Yeah, on
Carly?
her.
Okay.
Yes, with Carly. So let's talk about cool sculpting.
When we do flanks, we look for where we want to try to accentuate the waistline. So we find the smallest area, and we can either treat upper flanks or lower flanks. So on Carly, we're here, and we're going to do lower flanks. So we're going to do this area just below it. It's that area that bothers you with your clothes, or you maybe feel like you have a little bit hanging over.
Yes.
So basically we're going to kind of pull everything in. So the next thing I always do is have the patient stand in front of the mirror, and let's go. We're going to get her marked for the treatment. So we're going to pull this up. So Carly, looking in the mirror, just pinch the area that bothers you.
I really do not like this.
Right here. Okay, so that helps me know, I know where this treatment needs to go, but I also want to make sure I'm on the same page with the patient, and we are going to exactly get what bothers them as well. Let me grab a stool so I can be at eye level exactly where that fat pad is. So again, here is her waistline here, and we're going to go right below. So this area right here. This area is what's going to be pulled into the applicator. And there's a cooling panel on the top of it. So it's going to pull into the applicator. She'll be hooked up for about 35 minutes, and it'll be frozen to the point when we take her off. It's almost like a solid stick of butter. We'll massage it for 2 minutes, and that will help speed the process of eliminating those fat cells. So we're going to go ahead and get her marked.
Oh, I'm your assistant.
All righty. So
I'm going to jump in for just 1 second.
Sure.
On this, which one is this? Is Facebook, and so this is Instagram. Sorry, I'm holding the Instagram camera, and what you can see is that Jill's actually behind Carly, and we're looking in the mirror. So it's really important for the patient to know what's going on and to see what areas we are specifically treating. We've had cool sculpting in our office for 9 years. Yeah, we're probably up to like 6,000 treatments now, and we love, I'm going to scoot over here, we love cool sculpting because you get such amazing results with it. And there we go. And so anyway, so what Jill's doing right now is we have hand pieces that we use, and she is drawing the area of where the handpiece is going to go onto her skin. So what we wanted to show in this video is all the whole progression of how we do cool sculpting and how things work. So that's why we
turn to this side so you can see it. Go ahead and turn this way.
There we go.
Then I always explain to the patient that basically everything inside the circle is going to draw into that applicator. So it's exactly where she pinched. This is what's going to be treated right here.
Perfect.
Okay. So let's go ahead and mark your other side. And she has a little bit more volume on her left than her right, which is perfectly normal. Nobody is completely symmetrical. Okay, I'm gonna grab my other marker.
And then I mentioned everybody else, but I didn't mention Steph. And you can actually, there you go, there's Steph in the mirror. And Steph's my other superstar, my superstar video photographer. She does social media guru. She does it all. And show them your shirt, Steph, while Jill's doing that. Can you see it? And so we're in Friends and Family right now with color science. And so if you guys, when you think about coming to us, you're not just doing CoolSculpting. We're actually looking at the whole body. We're looking at your whole face, and we want to protect you with our color science products. So it's 30% off at our Friends and Family going on right now.
All right, looks good.
Oh, there we go. Perfect.
So now we're ready for
Cute.
photos.
And bye, rose green.
And same thing on this side. Everything inside this circle is what's going to draw into the applicator. So this is the fat pad that we're treating here.
All right. So what we're going to do is we're going to walk down the hall and go to our photo room. Photos are so important when we're doing any treatment at all, whether it's CoolSculpting or any kind of facial. I'm keeping you in the frame. And so what we like to take before and after photos because it's so darn important to watch, what's happening. To gauge your results, and people forget what they look like, and so sometimes it's hard because you look in your mirror every day and you think, ugh, why am I not seeing any change? But then when you see the before and after photos, you actually see the change. So this is our before and after room, and we have a photo studio basically set up so that we can take the same photos every time. So the lighting is going to be the same, and the background's going to be the same. And it's really important to have these standardized photos because we want to make sure that you're comparing apples to apples and not apples to oranges, because anybody can change the lighting and change the photos and make them look better. So they took photos already prior to the video without the markings on them. So typically what would happen when you come into the clinic is we would have done the consultation down in the room, in the CoolSculpting room with the mirror, and then we would come in here, take your photos, do the drawings in here, and then take the photos again. So this way we know exactly where the hand pieces are going, so exactly what our treatment is going to look like and where it's going to go. So if in the future, you say, you know what, I don't remember having that fat pad here or there, we can say, well, it was there before. That's not the area that we treated, which I know that sounds crazy, and that we really should remember where the patient should remember where the treatment is. But I tell you, life gets in the way. We get busy and we forget things that have been done. So okay, that's it, Jill.
All right,
okay.
We're ready to get her hooked up.
Okay, so we're gonna walk on back
to
down.
the treatment room.
Jill, you want to talk about some of the things that happen during the treatment? I guess you'll talk about as you're hooking up, but.
So once we get her hooked up, she's just initially going to feel a lot of pressure. The pressure is just all that tissue being drawn into the applicator. And then she's going to feel a lot of cold. I like to refer to it as like your toes in the snow. And it gets colder, 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 colder. And by the time it starts to get achy and starts to hurt, you go numb. Just like if you're out scooping snow and your toes are getting really cold, and eventually they go numb, and then you just don't even feel them. So when we come back in and do the massage after the treatment and that tissue starts to heal up, it's a lot like your toes in the snow as well. Whenever you come in from doing that, they ache, they kind of hurt. If you get in a warm shower, they sting a little bit. And so that's what the massage feels like, but it's perfectly tolerable. Patients do just fine with it, and we just do 2 minutes of massage to basically heat that tissue up and help to speed up the process of dissolving those cells.
Awesome. All right, so I'm going to come over here and we're going to look at the CoolSculpting machine itself. And then if you guys, before you hook her up, if you'll show the actual handpiece.
So her tissue is going to pull suction right into the applicator. The metal part is what's cooling the fat cells. And she will have a cool gel pad on top of her skin, and that's what's protecting her skin from the cold.
Okay.
So Nicole's doing her prep right now. Okay. Do you want to hand me gloves?
Yep.
Thank you.
For you, I'm gonna open it for you, and I'll just let you grab it.
I wish I had you in here with me every
I
time.
know.
No, it makes life easy breezy. There's a lot of moving parts to this treatment, so it always is good to have an extra hand and feet.
During most treatments, we do have patients kind of on their back, relaxing into the bed, but with this one it's a little different because it's an awkward spot, so you can't really lay on your back quite as easily. So when we're doing abdomen, typically you are just on your back or sitting up, and patients bring their laptop and work while they're doing this treatment. Some take a nap, some just read, some play on their phone. It's very, very comfortable. After you get through that first 5 minutes of cold, it's very comfortable. You go numb and you really don't feel it at all. So bring something with you to keep you entertained, or plan to take a nap.
That's right.
So that was the skin prep, and now we're going to do the pad. It's like it's covered in honey. It's very, very sticky, but the consistency of the sticky is like honey, and it's cold. So she probably will be like, ah, when we first put it on her. A lot of patients tell me that this is the worst part.
Is the
putting
cold?
the cold pad on, yeah.
Yeah, I remember it is pretty cold.
Not bad.
Okay, good.
No, you're fine. It's just the color of the marker is that pad took it off a little bit, but I can still see it. Okay. Can I have a wet washcloth just to get the sticky? Thank you.
And then I have a dry one for you.
Okay, I think this will do it. Actually.
See how great Nicole is? You never have to even ask. She just has
So
it.
Carly, before I hook you up, I'll actually have you kind of lean the other way because that creates more of a pocket to pull into the.
And we have all been to what we call CoolSculpting University. So Nicole and Jill and I are certified in CoolSculpting. Once we are able to send Carly, we will send her as well. But obviously they're not doing the trainings right now. So instead, Carly's been trained, with in person in webinars with our rep. But that's really what makes us different, is that we are 100%
Okay, I'm gonna go ahead and attach it.
certified and really are experts in the field.
Let's go ahead and.
So sometimes
I'm gonna resection it. So Carly's tiny.
She is tiny.
And I didn't love the suction, so
Okay.
we want to really see it pull into the applicator. And since she's tiny, we might have to adjust our angle just a little bit to get a better draw so that she gets a better result after treatment. So try to lean. So I'm repositioning her a little bit just to get a better draw.
hold that like that. Yep. Nice.
That's better.
Hold it nice and tight. Okay.
No, and when you're doing this treatment, you absolutely want to be in the best
Are we
hands
good
possible.
on
And so, as you can see, they weren't happy with that initial
okay.
draw. So now we have a great draw. So they are very happy with that. They're putting a boppy around. Any of you moms out there know what a boppy is. It's very helpful in CoolSculpting. So we use it all the time. And how does that feel, Carly?
Fine, just a little bit of pulling, a little bit of pinching, but not bad.
And then what'll happen is, it's a little different on the flanks versus your abdomen. On the abdomen, it's really pulling, and so you definitely feel more of the, how do you describe it? Just a pull. I mean, you really feel that. She probably doesn't feel it as much in the flanks because there's not as much, to pull.
Tissue, so you don't feel it a lot of times as much as you would the abdomen. This area is much more sensitive area, and sometimes patients don't feel it as much back here
basically just shrinking fat cells. The fat pad's getting smaller, but there's the same amount of fat cells. With CoolSculpt, we are actually eliminating fat cells. So the fat pad is reducing by about 20 to maybe 30% with each treatment. So Carly will do this today, and then typically with most areas you come back and do the treatment again in 30 days. So with CoolSculpt versus weight loss, the fat cells that are there will be the same size, but we're reducing the number of fat cells. This diagram refers to that. And basically, here's your before, and the person who lost weight has the same number of fat cells in every area. They're just smaller. But after CoolSculpt, they are actually less fat cells in that area. And we usually get about a 20 to 30% reduction with each treatment. So it is definitely one of my favorite follow-ups to do because it's just so easy. It's like it's right there, and patients are really excited about it.
And talk about how it's not really for weight loss. You know, you just said that, you know, it is shrinking the fat cells and
we do a consult. Not everybody's a candidate, so it's important to do a consult first to make sure you're a good candidate. And the fat has to be outside of the abdominal wall to get a good treatment with CoolSculpt. So someone with a very hard watermelon belly where the muscle is on the outside is not necessarily a candidate. We need to be able to pinch and pull that fat away from your body to get that good draw. So that's why we always do the consult first, just to make sure that you're a good candidate before this procedure. Would you ask me on when?
That it's not really for weight loss.
So the fat that we struggle with, especially women in menopause, in our abdomens, it's kind of squishy. You can pinch it and pull it away from your body. If we were to remove that fat and weigh it, it actually doesn't weigh anything. It's like cotton balls. You know, it takes up volume, but it weighs like cotton balls. So it's not necessarily it's going to change inches, but not necessarily the number on the scale, because the type of fat that's being removed is that fat that doesn't have much weight to it, but it's also the fat that doesn't respond to diet and exercise. So, you know, you can be working your butt off at the gym and eating right, and unfortunately, that's the fat that doesn't go away. So that's why CoolSculpt is great to help get the result in those areas that don't respond to diet and exercise.
And let's talk about the areas that you can treat with CoolSculpting.
Oh yeah, sure. I'll show you my diagram because it kind of pulls it all together here. So we can do under the chin. We can do bra fat, which is that fat right on the front inside of your arm. We can do back fat, upper arm fat. We can also treat flanks. That's what we're doing with Carly today. Abdomen, the banana roll underneath the buttocks, and also the inner and outer thighs. And then if you want to zoom over here. So this diagram here shows the number 1 is showing those yellow cells are the fat cells. Number 2 is showing those cells that have been cooled to a degree that they will actually dissolve and be eliminated through the lymphatic system. And so that's how our body gets rid of the fat after CoolSculpt. So basically, by eliminating it through the lymphatic system, you're going to pee it out. You're not going to see it. You're not going to smell it. You're not going to feel it. You're not going to even know it's happening. So then at the end here on the diagram, this is showing the good result at the end. So, you know, the fat cells are the same size, but a much smaller fat pad in that area.
Okay.
So that's how it works.
Awesome.
It's pretty amazing. A lot of patients will also ask if it's safe for their organs, and it absolutely is. So you can kind of think of it like eating a large serving of fast food French fries, but instead of processing it all at once, your body will be like processing 1 French fry a day for the next 30 days. So you will get your full result after treatment up to 90 days after treatment, but you will start seeing results at 3 weeks. But it's like processing just 1 French fry a day. That's the amount of fat that's moving through your organs during this process. And we already talked about this one. That's the weight loss. This is just showing the applicator, which you can actually see right here. And so we do develop a customized treatment plan for each patient, and we'll tell you, you know, how many treatments you'll need in that area. Typically, in most areas, it's 2 treatments 30 days apart. In a couple of the areas, we may move a little slower. One of those is the arms. We may do a treatment and wait 90 days for arms just because there's a smaller fat pad and a smaller room for air or improvement in that area. How are you feeling?
Good.
Are you numb?
Getting there, yeah.
Getting there?
It's pretty
Good.
numb.
So Carly is about 7 minutes in to the treatment right now. It runs for about 35 minutes. She's about 7 minutes in. In the next 3 minutes, she'll be numb. It really does not take long. Some people are actually numb already at 7 minutes, but by 10 minutes in, definitely she'll be numb.
Let's talk about after the fact. I mean, you already just mentioned, when to see results, but what do you expect to feel after she's done with this
Yes.
treatment?
So when she first leaves here, her main thing will be numbness. She'll still be numb from the treatment. She will feel numbness and tingling and have some swelling for up to 2 weeks. For most patients, it's more like 7 to 10 days, but for up to 2 weeks, numbness and tingling, and it's just an odd feeling. When you touch it, it might feel a little bruised and numb, but then every once in a while, you'll kind of have that tingling sensation. Usually it's gone in 2 weeks. Some patients, when they come back for their second treatment, feel it just a little bit, but it does completely go away typically after 2 weeks.
Okay. And
the swelling is, you'll notice it, but it's minimal enough that nobody else will notice it. And it's interesting because it's kind of like a hard swelling. The tissue will feel much firmer when it's swollen. But for our ladies, usually just tunic tops and a bulky sweater in the winter or something like that, and they can cover it really, really easily.
who is not a candidate for CoolSculpting?
So one of the biggest things is we assess everybody to make sure that your fat pad is perfect for the applicator. So, you know, we've had to turn people away if their arms just aren't the perfect size for the applicator. Another one is outer thighs. We only have one size, well actually two size applicators that we can put on the outer thighs. So if you don't fit in there perfectly, we won't do it. We want a good result and we want happy patients. So if we don't feel like it's right for you, then, you know, we may recommend something else and go that route instead. But those are kind of the two main ones. And then the other one I would say is the person that has, you know, maybe the abdomen's distended, but it's just too hard to where we can't get the draw into the applicator, because we have to be able to get a good draw and a good suction for it to work. For some patients, you know, we'll do a test. We'll hook you up to the machine, just in the consult, hook you up to the machine, make sure we're happy with the draw before we decide for sure you're a good candidate for the procedure.
So what I'm hearing is almost everybody
Yes.
is a great candidate. So that's the beauty of CoolSculpting. I mean, as you said, we do turn people away because we don't want to have the you know, not so good results. However, most people are good candidates. Now, let's talk about if you, like, what your weight should be. You know, we really shouldn't be too overweight, correct?
Yes. So we want, you know, we want to treat whoever we can. There may be some patients where we'll recommend doing our ideal protein program before CoolSculpt, and it's actually saving the patient money in the end. It's like, let's do ideal protein and get you a little closer to your goal, and then maybe you don't need as much CoolSculpt, and it makes it all more affordable for you. I've had patients even that have done ideal protein and then they discover CoolSculpt and they're like, gosh, I've been exercising and eating right, but there's this one area, it really bothers me. And so it's kind of nice because it's like, it gives them that boost to keep going. So, you know, they may then do the lower abdomen because it's not responding to exercise or whatever. And then it just gives them, it makes them feel better about that area, and it gives them the boost to stay on track with their eating right and exercising as
Right.
well.
Because everybody will ask us, well, should I lose weight first? And I think if you are within, 20 pounds of your ideal weight, really you have either option. You can lose weight beforehand, and then maybe that gives you like a goal, almost like a reward
Right.
to do CoolSculpting.
Uh-huh.
Or, as you just said, maybe it's going to kickstart it for you,
Right.
and you feel like, okay, if I can get just just get on board with this, get a little kickstart, then do CoolSculpting then continue to do CoolSculpting and weight loss,
Right.
then I think it all works together. So I always tell everybody it's more of what you want out of the treatment itself.
Uh-huh.
You know, if you are one that needs a reward, then do it that way. If you're one that needs a kickstart, do it that way. So I think that's a question that we get asked all the time. I had another question a second ago. I think we've pretty much covered everything. Talk about the hand pieces just a little bit more.
Yeah.
Because as you said, we have the outer thighs and we have the arm pieces that they have to fit just right. But what about the chin? And
So-
what about our abdomen?
We have, it's called our mini handpiece that we use on our chin. And it's tiny, it's cute, it's got this cute little cup. But it fits right under the chin. And we can do either a side-by-side or just one, depending on how much fat is in that area. The cool thing about that handpiece is it also grabs really well for bra fat. So a lot of people, a lot of ladies come in and it's like, I just can't get rid of this. I've been working out and it just won't go away. So it just cups that perfectly and it gives a really, really nice result. That's one of those where we might treat and wait 90 days and then bring you back. We do follow-ups at 30, 60, and 90 days. So along with those follow-ups, we'll kind of look at it. We do your before pictures and your after pictures, pull them up together and see what kind of change we're getting. But that's one of those we probably would wait 90 days before doing that second treatment. Again, because it's a smaller fat pad, so not as much improvement is needed in that area. So the chin works great, and it's awesome in conjunction with Kybella. So somebody that has just a little bit of fat there, we can do CoolSculpt first, and that debulks the area. And then you can come back and see Dr. Jacobs for Kybella, and Kybella dissolves the fat, and it's an injection, so she can put it exactly where it needs to go. And it gives a really nice definition in the jawline to debulk, and then inject in that area and help dissolve the fat to give that nice jawline definition.
And then talk about the abdomen ones. So, where you have the I call them golden purple.
Yeah.
I'm still old school.
We have this. Carly is tiny. She's got the smaller handpiece on. I will show you the. Let's see here. This is our Mac Daddy. It's a big one.
Yeah, and what would you say? I mean, the majority of patients really aren't going to use that one.
So a lot of times we do a combo. You may have, a popular one is this on the lower abdomen, and then the handpiece Carly has on the upper. So this sucks in about twice as much fat. Another thing that's really common is maybe we do this on your first treatment, but then when you come back for your second treatment, it's dissolved enough tissue or dissolved enough fat that we can move. Your fat pad might need to be smaller and need something like this. So it's really just assessing the patient to get, we want the best outcome possible. So we'll recommend what's gonna get you there.
Right, and your treatment plan may change over time, like you just said.
Right.
Which is, that's the beauty of, again, coming to a clinic that has so much knowledge. We do this all the time, and we feel very confident in our treatment results. So I think, do you have anything else to add, Jill?
I think so, Carly.
I can go on with my day after this.
Well,
Right.
Right, exactly. And that's what's important too, is that there really isn't any downtime with this. So how do you feel right now?
Fine.
Do you feel like it's even on there or no?
No.
Yeah,
not at all.
okay, good. So what we're going to do is we're going to go ahead and end the show now. But what they're going to do is Steph's going to come back and she's going to video the unhooking process, the rehooking process. Oh, thanks. And then, here, I'll turn me around here. So we're going to video the unhooking, the rehooking, and then we'll also do just a quick recap at the end so that you guys can see the whole process. If you sat here on our live video, it'd be very boring because hopefully Carly, maybe she'll go to sleep. I don't know. We need to add a few more pillows to her. But anyway, hopefully you enjoyed this. If you have any questions, please don't hesitate to reach out to us.
Be more comfortable to
We
lean
are
back a little
all
bit.
about education and about results.
I don't think it's
so
going
even if you
anywhere.
think,
If you're more
I just
comfortable
don't
a
know
little
if I'm a candidate, it's okay. We want you to come in and we want to talk to you about it. People ask all the time, how much it is, and we didn't talk about that. And really, it's hard for us to give you a price because everybody is so different. And so we don't want to just throw out prices at you because you may be, like Carly, you know, she may be for, I was going to call them syringes, here I'm doing filler, for cycles, thank you. But somebody else might be 8 cycles. And so we really like you to come in, we can have a conversation, and we can tell you exactly what the price is at that time. So, okay, anybody else? Okay, all right, thank you guys, and we'll wait for these videos to see the rest of the treatment. Thanks, bye-bye.